Nephron. Nephron is a functional unit of kidney. There are 1.3 millions of nephron per kidney. Each nephron is formed by two parts, that is renal corpuscle and renal tubules. Renal corpuscle is formed by two portions, glomerulus and Bowman's capsule. Glomerulus, the diameter is around 200 micrometers. Glomerulus is a tuft of capillaries enclosed by Bowman's capsule. Blood enters glomerulus through afferent arteriole and leaves through the efferent arteriole. Bowman's capsule is a dilated portion of a nephron. Renal tubules. There can be proximal convoluted tubule, that is PCT. It has different parts, pars convoluta and pars recta. That is, pars convoluta is a convoluted portion, whereas pars recta is a straight portion. Its wall is made up of a single layer of cells whose luminal edges have striate brush border due to the presence of microvilli. Tubular cells are rich in mitochondria. The tubular cells are connected by tight junctions at their luminal edges. But there is a space between the cells along the rest of their lateral borders called lateral intercellular space. Loop of Henle. It consists of a descending and ascending limb. The descending portion of the loop and proximal portion of the ascending limb is made up of thin and permeable cells, whereas thick portion of ascending limb is made up of thick cells containing many mitochondria. Distal convoluted tubule, that is DCT, has few microalveoli present. There is no distinct brush border here. Collecting duct. The distal convoluted tubule opens into collecting duct. Epithelium made up of principal cells, that is P cells, and intercalated cells, that is I cells. P cells, they're mainly involved in sodium reabsorption and vasopressin stimulated water reabsorption, whereas I cells are concerned with acid excretion and bicarbonates. Based on the situation of renal corpuscle, nephrons are classified as a cortical and juxtamedullary nephrons. So this is the typical part of the nephron, which will be comprises of glomeruli and the tubules. Tubules, it can be proximal convoluted tubule, which is convoluted. Again, it has a straight part. Then we have a loop of Henle. Then distal convoluted tubule. Then we have collecting duct. And in the different parts, the organization of the cells, they are going to differ a bit. Where in proximal convoluted tubule, the cells have a microvilli and they possess brush borders.